Hi, I'm Dr. Jay Sordean. Thank you for listening in on this brief little introduction to why choose a functional medicine doctor. Well, it is well stated that the doctor of the future will give no medicine, but will instruct his patients in care of the human frame, in diet, and in the cause and prevention of disease. So essentially, this is the underlying philosophy of functional medicine, and many physicians in the past actually have said this. This is a very, very ancient thing that was said, I think, by Hippocrates. But it has not been really taken to heart for many years. So when we look at this chart here, this is spending on health care per person. You can see that despite spending more on health care than the next top 10 spending countries combined, America still has more chronic disease, chronic illnesses, and a shorter lifespan than most other industrialized nations. An alarming number of people are suffering from fatigue, headaches, pain, indigestion, skin problems, and other things, and the medical community is failing to provide an answer. Looking at this chart, you can see as well, our infant mortality rate, meaning how many babies don't make it through their first year of life, is one of the highest in the industrialized nations. This is a tragedy, and a travesty. So in this chart, we can take a look at this. There was a study that was done comparing the healthcare system of the United States to 11 other countries. The United States came in last place in numerous categories here. You can see the U.S. is here over along the right-hand side, and you can see the numbers that are in there comparing the other countries. And the U.S. is very low in a number of categories. Here, you can see the overall, Australia had 33 categories. The U.S. was number 37. And this was just this is below Costa Rica, Dominica, Denmark, Argentina, Chile, and Australia. So, medical system really is not that great in the U.S. And when expanded to a global scale, we can see that we're number 37 in the world in healthcare. Now, this rating was determined by multiple categories, including efficiency, cost, number of healthy people, lifespan, and more. So, the question is, what are we doing wrong? Well, the key word is prevention. These other countries focus on how to prevent patients from ever having health problems rather than focusing on what to do once they're sick. Because if people have watched any of my other videos that talk about chi and blood and organs and the central nervous system, how our body functions overall, our functioning is the bottom line. As our function degenerates, we start to develop malfunctions. As it continues, we start having disease. And then our function has to get so low, down to almost 40% left, that we start to have symptoms. So preventing people from ever having these functional issues is really the key, rather than just focusing on what happens when you have symptoms, which is when your function is really low already. Now, most people have no idea how good their bodies are designed to feel. In the U.S., it's common for people to deal with fatigue, aches and pains, heartburn, headaches, and other maladies, and they just consider them to be a normal part of life. However, they are not normal. This is not showing healthy. There's actually a reason why our bodies feel the way they do. And functional medicine is here to find that reason, to find out the underlying functional degeneration that led to these feelings and symptoms. The next few pages will give you a good idea what functional medicine is, how it is different from the current model of healthcare, and how it can help you, and how I might be able to help you. So, functional medicine interprets labs differently. So normally when you get your blood work done, you'll notice that there are what's called a reference range along the side. So it's actually called a reference range and not the healthy range or normal range. So how do they determine these reference ranges? Well, each lab does their own set of tests and determines their own normals based on all the specimens that come in. Now, a few hundred healthy people, meaning they have no diagnosed diseases, have their blood values drawn. Then they're averaged, and that creates the, quote, normal range. However, it's really just a bell curve of all the samples that come in. So even though they may not have any diagnosed disease, many of these people are still suffering from fatigue, upset stomach, headaches, heartburn, pain, and more. And while these may not be the most detrimental of problems, they're still not what we consider perfect health, and that's what we want you to have. So the normal ranges being used are not truly normal, and they're not truly healthy. That's why functional medicine practitioners use a different set of ranges as well as a tighter set of ranges. So here's a whole level of different ranges here. You can see while there's many things that modern medicine is needed and good at, one of the big things they're failing at is prevention. The way blood work is read is that you reach a certain number and all of a sudden, poof, you have a disease. But there's really a big hill to go up or down to reach that number. It's often a slow decline that one could pick up on these deteriorations earlier on. But most medical doctors just don't have the training to see these patterns in the blood and step in before the patient reaches that critical number. Functional medicine practitioners, on the other hand, are trained to look at a patient's blood work and know that in, let's say, 5 to 10 years, that magic number is where a patient's going to be if they don't do something to change. So let's make a change now. Functional medicine practitioners often run more extensive lab tests. So these are examples of ones that should be done for thyroid. In addition to interpreting the labs that mainstream medical practitioners run differently, functional medicine practitioners, as I said, also tend to run additional lab markers. Typically, the labs in the standard model of care diagnose a disease so that it can be matched with the corresponding pharmaceutical drug. If there's no drug to help with a certain step or pathway in a patient's physiology, that step is not normally run, and that test isn't run, because medical doctors don't normally know anything else to do. So if there's not something they can do, they won't run a test to see what's going on. Therefore, the labs your doctor runs are adequate if he's just prescribing medications, but they're very much incomplete from a functional medicine perspective. Here's an example using the thyroid. Now, many people today are having hypothyroid symptoms, but their blood tests don't reflect what they are feeling. Mostly, that's because there are only two markers being tested, TSH and T4. Now, this picture shows the process of thyroid hormones being made. They circulate through the blood and attach to cells to properly stimulate the cells. Each star represents a different step and a different place to test hormone levels, to test proteins and enzymes involved in the process. Now, why it became normal to test only two of these steps, especially when the patient is having symptoms, is quite unclear, really. However, once we start looking at the whole pathway, it's easier to find where there's a breakdown and how to best help the patient. So you can see that on this chart, there are many locations where something could break down, many steps in the process, but they aren't being looked at in the standard lab test, which is why we do a more extensive test to find out what's going on so we can help. Now, as functional medicine practitioners, we customize your health care. On the other hand, once you're labeled with a disease, in mainstream medicine, you're given the same medications everyone else is with that disease. They may alter it according to you a little bit. Maybe you react badly to one or another, but essentially it's the same selection of different medications. No, this is a cookie cutter approach. And it works sometimes, but more often than not, it fails and actually causes other problems in the long run. Functional medicine takes into account that we're all designed a little differently. So what works for one person isn't necessarily best for you. A tailored, comprehensive health program addresses you as the unique individual that you are. That is the right way to go about helping you best and most effectively. Now, mainstream medicine is very focused on symptom care. That is why every 6 months you typically wait an hour at your doctor's office for a 5-minute visit. At this visit, they look at your blood work, match up the numbers to any drug they think you need, and send you on your way. This system is actually failing millions of Americans who are suffering from chronic health problems. Now, again, each of us is different. That's why functional medicine practitioners take the time to determine what a patient's lifestyle is like, what their stress levels are, what they eat, and how much movement they get in a day. All of these impact our health and must be considered. That's why we spend more one-on-one time with patients. In our picture of the trees here, you can see heart disease, cancer, allergies, anxiety, all these different diseases at the top. And then we can see underneath there the roots. Things like lack of exercise, poor digestion, poor diet, lack of sleep. Well, in this picture of the tree, you can see that we have the leaves and the branches above the ground and labeled with different conditions. There's depression, anxiety, heartburn, heart disease, irritable bowel syndrome, diabetes, cancer, allergies, and more. In mainstream medicine, once you're labeled with one of these, that is normally as far as the doctor looks. On the other hand, as a functional medicine practitioner, I like to go below the surface to the root of the problem. Nobody has heartburn because of a Prilosec deficiency, and nobody has high cholesterol because of a Lipitor deficiency or a statin deficiency. That just is not how our bodies were designed to function. Once we begin looking at things like inflammation, nutrient absorption, and stress levels, we can understand why the body is reacting the way it is and know thus how to help it. Functional medicine, and I am not anti-medication, but I do ask what the patient's most effective option is and what causes the fewest side effects. Very few times is the answer medication. Somewhere in the last 100 years, mainstream medicine grew away from the thought that what we put inside our bodies isn't really affecting our health, and that it's not to blame for the huge increase in chronic conditions. However, scientific studies have shown that to be completely wrong with the law of 20. The law of 20 states that 20 years after refined carbohydrates and processed foods are introduced into a society, they will begin to suffer from problems like diabetes, cardiovascular disease, cancer, and other illnesses. The more that society eats that kind of food, the more illnesses they have. This has been shown time and time again, country after country. So, no, we don't shy away from natural treatments. We embrace them. More often than not, natural treatments will be much more effective and have much fewer side effects in the long run. So I hope that gives you a well-rounded idea of some of the reasons why functional medicine practitioners work in a different way from mainstream medicine, and the rationale and the good scientific basis for that. We want to help you as naturally as possible so you aren't putting in things that damage your body. So now that you understand that, you'll either know this is for you or it's not for you. If it is for you, please call now to make an appointment at 510-849-1176. That's 510-849-1176. And you can get more information as well at our website, theredwoodclinic.com. theredwoodclinic.com. Thanks so much. This is Dr. Jay Sordean, urging you to take the natural path to optimal health.